Hello and welcome to my channel. My name is Kev, and in this video I want to talk about the symptoms, diagnosis and treatment of psoriatic arthritis, as well as the impact that it can have on your life. At the end, I will also share the 6 things that I do every day that have helped me manage the condition over the last 10 or so years. But first, a quick disclaimer. I am not a doctor, and none of this is medical advice. I'm just a person that has lived with psoriatic arthritis for around 20 years now. So everything I'll cover on this video is based on personal experience and the various things that I've learned over the years while self-managing the disease. Psoriatic arthritis is a painful but difficult to diagnose condition that affects millions of people all over the world. However, because of the difficulty around diagnosis, many people suffer with this condition for years without ever understanding what's actually going on. Part of the problem is that both the severity and the presentation of the symptoms can vary wildly from person to person. So let's first look at these symptoms from a high level, and then we'll dig a little bit deeper. Some of the most common symptoms include inflammation and swelling in the joints, pain and stiffness in the joints, chronic fatigue, eye problems, skin changes, back pain, and difficulty moving. Now, as you can see, all of these symptoms are pretty typical of many other conditions too. So we need to go a little bit deeper, starting with the skin. The psoriatic part of psoriatic arthritis refers to psoriasis. This is because psoriatic arthritis is typically found in people that have psoriasis. In case you've never heard of it, psoriasis is a chronic skin condition that presents as patches of red and itchy skin that are often covered in silvery scales. This tends to affect people usually on the scalp, the elbows, and the knees, but again, the severity can vary wildly from person to person. Psoriasis can also be seen in your nails and shows up as pits or maybe dark spots on the nail and even separation of the nail from the nail bed. So the skin and the nails are pretty telltale symptoms for psoriatic arthritis. Next, of course, is the joint pain. Psoriatic arthritis in particular seems to like to target distal joints. So these are the joints that are far from the center of your body, like your wrists, the joints in your fingers, and the joints in your toes. This can also manifest as something called dactylitis, which is where you see swelling in the entire finger rather than just the individual joints in the finger. This condition is also known, somewhat cruelly, as sausage fingers, because your finger can swell to the extent that it looks like a sausage. This joint pain is not exclusive to the distal joints though. It can also affect your back and your hips, and it can even affect some of your tendons. So this is the point where the muscle connects to the bone. When it comes to pain, there are a lot of different reasons why you might be feeling pain in your body. But with psoriatic arthritis, you will tend to find that the pain is worse in the morning and gets better with movement. I'm going to dwell on this point for a minute because it is really, really important. If your pain gets better with movement and worse with rest, you might be dealing with psoriatic arthritis or a similar condition. This tends to be a bit of a giveaway. Usually if you've got pain in a joint or if you've injured a joint, it will get better with rest and worse with more activity. I also included eye problems and chronic fatigue in the list, both of which can be symptoms of psoriatic arthritis, though perhaps less obvious. So if you have psoriasis and you're experiencing some of these other symptoms like joint pain and stiffness that gets better with movement and worse with rest, you should probably go see your doctor and ask about psoriatic arthritis. So I want to kind of go off script for a while and just talk about my own personal experience with managing psoriatic arthritis. So for each section in this video, I'll take a break and we'll just relax and talk a bit more casually about some of my experiences. So in terms of symptoms, the first time that I remember actually experiencing the feeling of arthritis was around 20 years ago when I was 19. And I remember pretty clearly because I was on my way to college and I was walking to the bus stop, and as I was walking towards the bus stop I noticed that off in the distance there was a bus coming. And the bus was going to make it to the stop before I did. So I'd need to run. Now, I was pretty unfit at the time, pretty unhealthy. I was living a college lifestyle, drinking, smoking. So I wasn't in great shape. And I remember as I started to run, I was getting out of breath. My face was turning pink. But as I as I went from walking to running, I felt this kind of stabbing pain in my hip. Now, I know now that this is what's called a flare up, right? This is a period of time where your symptoms get worse. And what it feels like, the way I always describe the pain in my hip, it's as if a piece of Lego is in there. Like if you've ever stood in a piece of Lego, you'll know that it's pretty uncomfortable. So in my hip, it's like there's a piece of Lego floating around in there. And every now and again, that piece of Lego gets like wedged in between the actual ball and socket of the hip joint, and it's very uncomfortable. It's a sharp kind of stabbing pain. And I was running. Well, I wasn't really running. I was hobbling towards the bus stop, and I was in quite a lot of pain. And I thought, I'm sure I felt this kind of pain and discomfort before that, but this one really stands out because I got on the bus and uh, the bus was pretty crowded, and I noticed that there was an empty seat, and it was beside a guy that I knew. He wasn't a friend. I kind of knew him. He was a guy that was in my brother's year in school. And I sat down beside him, and at this point I was out of breath. I was breathing heavily. I was pink in the face. And when I sat down beside him, said hello and all that sort of stuff, he asked me what's wrong, what's wrong with my back or what's wrong with my leg, because he saw me running for the bus, but I wasn't really running. I was hobbling, and it was at that point where I realized that this busload of people that was driving kind of down the road and around the corner to the bus stop had seen me kind of hobbling awkwardly across the car park. And it was a car park I was running across. It was like a shop and a pub, and um, I felt I felt really embarrassed, to be honest, because I realized this bus full of people had just seen me kind of just hobbling across like a. In my head, I was thinking like a cripple, and had I not been already like pink in the face from being unfit and from the light jog that I had to do to get the bus, I probably would have been pink from embarrassment. And the pain, it was there, it existed, and then it disappeared. That's kind of how flare-ups work, especially in the early stages. And at the time, I just thought I had a bad back. I was sitting a lot. I was in college learning how to program computers, so I was sitting at computers all day, and they tell you sit at computers, you're hunched over a keyboard, and it leaves you with a bad back. So I just thought I had a bad back, and it gets particularly bad from time to time. Um, and that's the first memory that kind of stands out in my head. But over the years after that, it kind of changed and evolved. Like that hip pain was kind of always lurking. That piece of Lego is still just floating around in there, and every now and again it kind of starts to cause trouble. But over the years, I started to feel stiff. I if I sat on a couch for a while, and I went to stand up, I'd feel sore. I'd feel stiff. It was weird. And again, I just thought I got a bad back. That's just my life. And towards the end of college, actually after college, when I started working, um, I started to go for walks in the evening just to get out of the house. I was living at home at the time, and after a while of walking, I decided I wanted to start running. So I started running and noticed that I was getting injured. Like my knee would get sore, my hip would get particularly bad. I'd wake up in the morning and I'd be stiff. And this just kind of progressed over 10 or 15 years. It took me like 15 years before I got a diagnosis. And when I looked it up, this is actually somewhat typical. I think in the UK, I read some stat that um, the average time to diagnosis can be as high as 12 years. So over that entire time, I kind of just thought I had a bad back, and that's what it was. And at one point, I went to a physio, and the physio said I probably have a bulging disc. Um, oh, we have a visitor. So this is Mona. She came to visit. Say hello, Mona. Um, and I remember the physio told me I had like a bulging disc. He gave me some exercises to do, and at this point, I was kind of starting to work out and stuff. I was mostly working out at home, and but I kind of just kept getting injured. I was sore all the time. I remember the physio saying I probably had a bulging disc and recommended I do Pilates, which I started doing. And it's interesting because arthritis didn't really occur to me at first. Around 30% of people, 20 to 30% of people with psoriasis end up with psoriatic arthritis. But 15% of the people with psoriatic arthritis show the symptoms of arthritis before psoriasis, and I was one of those people. So it was actually a few years I'd be dealing with pain and stiffness on before the psoriasis started to show up. It was probably about 6 or 7 years, maybe even longer, before I started to get psoriasis. And at that point, I remember going to a doctor and asking for a blood test, and I'll get into this more in the diagnosis section, but um, basically I was misdiagnosed or not diagnosed at that point, and I just let it continue for years. That was 15 full years of kind of gradual um a gradual increase in the symptoms that I was experiencing. And for me, it was primarily, so my cat is meowing in the background. And it was primarily my back. So it was my back and my hips, and again, just a bad back. That was it. That was the main symptom that I had. Now, as time progressed, I noticed my wrist starting to get bad, my big toe in my right foot. It started to swell up, and it's still swollen at this point in time. So I kind of, the joint pain, a bit of the swelling, were the main symptoms. I never really felt fatigue, I don't think, but again, I'm not sure if my exercise routines were offsetting some of that fatigue. Um, so they were the symptoms that I experienced, and it was very easy to write them off as something else, and that's one of the challenges with psoriatic arthritis. Okay, so now let's talk about diagnosis. But before we get to the specifics about diagnosis, I'd like to talk a little bit about what's going on in your body. Because if you're experiencing any of these symptoms, you're probably asking the question, why is this happening? And the answer to that question is because you've got an immune system that is a little bit confused. The reason your immune system is confused is because of a whole mess of complex factors relating to genetics and environmental triggers. So we're not going to go too deep into all of those complexities. What's important is understanding a little bit about your immune system and about inflammation. The immune system is a network of biological processes that protect living organisms like us from infection and disease. Plants and even bacteria have developed these defenses against infections and disease, so clearly an immune system is pretty important for living things regardless of their complexity. So, if for example you get infected with a virus, your immune system will trigger an inflammatory response. This inflammatory response will, among other things, send white blood cells to attack and deal with the threat. Similarly, if you were to get a splinter in your finger and pull it out, your immune system will again trigger this inflammatory response, which will help repair and clean the wound. As your immune system goes to work, you will probably notice that the area where you got the splinter goes red, it starts to swell up a bit, and even might get hot to the touch. If you've ever had a piercing or a tattoo, you'll be very familiar with this response, where the skin gets hot, it can feel tight, and can feel swollen. This is inflammation, and it is a normal part of how your body functions. So what has any of this got to do with psoriatic arthritis? Well, as is often the case with complex systems, our immune system can sometimes behave in abnormal and unexpected ways. An example of this abnormal behavior would be immunodeficiency. This is where the immune system is less active than is typical, meaning it is less effective at doing its job. So if you have an immunodeficiency condition, your body will have a harder time fighting off infection. Another example would be autoimmunity. This is where your immune system is overactive. And psoriatic arthritis is an example of an autoimmune condition. In my body, and in the bodies of other people that are living with psoriatic arthritis, the immune system will mistakenly identify my healthy cells as a threat and will trigger its defensive protocols. When this happens consistently over time, we refer to it as chronic inflammation. Now, as I said, inflammation is a perfectly normal part of how your body functions, but when your body's in a constant state of inflammation, it can cause a whole host of other problems. With psoriasis, what happens is your immune system is attacking your healthy skin cells. With psoriatic arthritis, your immune system is attacking your own joints, which is where the pain and the stiffness comes from. So, diagnosis. How do you know if you've got chronic inflammation, and how do you know if you're living with psoriatic arthritis? Well, the obvious answer is you need to go and talk to your doctor. Your doctor will likely want to perform a physical exam, see how well you move, see do you have anything that looks like a rash but could be psoriasis. They may want to talk about your family history. Like I said already, there's a significant genetic component here. They may want to take some blood, and then they can run all sorts of tests for inflammatory markers such as C-reactive protein, where if the level is high, it could suggest that the level of inflammation in your body is higher than it should be. And they may want to do some imaging, so MRI or X-ray, to see if they can see any signs of inflammation in or around your joints. Your doctor may also refer you to a specialist, like a rheumatologist, for confirmation. Now, I think it's important to say that as you're going through this process, you also have a part to play. Listen to your body. Pay attention to what it's trying to tell you so that you can better communicate to the doctor and healthcare specialist that you will be working with so that you can faster diagnose the condition and get the treatment that you need. So, diagnosis. As I mentioned in the last intermission, it took me. I was living with this for about 15 years before I got diagnosed. And like I said, I went to a physio, and the physio actually told me, I could go get an MRI, but it would probably just confirm that I had a bulging disc. Which, to be fair, the symptoms of a bulging disc can be quite similar in terms of stiffness in the morning and improvement with movement. And I remember going to the doctor because the psoriasis had come on at this point, and I actually said to the doctor, look, I've got psoriasis, I've got a family history of psoriasis, and I'm concerned about psoriatic arthritis. So she took some blood, did some tests, and a few weeks later, I'd kind of forgotten about it, and then I remembered, so I texted the doctor and said, hey, get those results. And she said, oh yeah, sorry, everything's fine. So I just kind of continued for years after that, trying to sort out this bulging disc that I thought I had, but my back was strong. And some of the common causes of lower back pain that I tried to address, like weak glute muscles, like the glute muscle on the side in particular. I was, working out, improving my mobility, improving my flexibility, but the pain was still there. And it was, like I said in the list of symptoms, it would be worse in the morning, it would get better with movement, especially after a workout, doing some squats or something like that. I would feel a lot better. And it wasn't until I went for a second opinion, I went to a different physio, and the physio ran me through some drills. He asked me to do like a one-legged squat, which I was able to do. He asked me to lift my leg in a certain way where he saw I had kind of crazy hamstring mobility and flexibility. And he just said on the spot, you need to go see a rheumatologist. So I went back to the doctor, got a referral to go see a rheumatologist, and the rheumatologist did an MRI, did some more tests, and confirmed psoriatic arthritis. He showed me the MRI results. You could actually see the inflammation in my joint there. And that was the diagnosis. That was 15 years after that first flare-up when I was about 19. So what about the impact that psoriatic arthritis has on your life? Well, I'm going to be honest here. It can be pretty rough living with psoriatic arthritis. It can affect your ability to work, your ability to exercise, and how you even engage socially with other people. It can also affect your mental health, triggering stress and anxiety, which itself can make the inflammation worse. On top of that, people with psoriatic arthritis and psoriasis actually have a greater chance of getting conditions like cardiovascular disease and even some cancers. So this is serious, and you do need to take it seriously. It's also probably a good idea to try and put some sort of support system in place to help you deal with the emotional toll that living with a chronic disease can have. On this topic, I'd like to speak from a personal perspective because I think that's probably more useful. So, the impact that psoriatic arthritis has on your life. I still remember the day I got the diagnosis because I actually felt relieved afterwards. For years I'd been dealing with this weird chronic problem that I didn't seem to be able to fix through exercise and mobility work and flexibility work, doing yoga, doing Pilates, working out. I even trained as a personal trainer so that I could learn more about my body, my physiology. I could program my own workouts and learn how to train more effectively I also got certified as a nutrition coach so that I could nail in my diet part of it, and that was all to try and solve this mystery issue. Um, but when I got the diagnosis, I felt kind of relieved. The thing had a name, and now I could actually focus on dealing with it. But that feeling of kind of relief and almost being happy about it, it didn't really last that long, because the knowledge that this thing is going to be with me for the rest of my life kind of settled in at that point. And it can be pretty rough waking up in the morning. You've had a bad night of sleep because you go to bed, you're lying still for a few hours, you turn over in the middle of the night. Stiffness in your body and in your joints means that the pain of just turning over can wake you up. It can be difficult to get back to sleep because it's hard to get comfortable, and wake up and you'd be sore, and then you can't help but think, this is it. This is every day. It's hard to be positive about the future, knowing that that's what the future is going to be. So I'd say over the following 2 years, it kind of crept in like this. The emotional weight of the diagnosis kind of crept in over the following 2 years, and I'd say I'd never really, I don't think I'd call it depression. So it probably was. It felt to me more like nihilism, like feeling like everything is pointless. What's the point? It wasn't that I wanted to die. I just cared less about living. And it can really get on top of you. So it can have a pretty heavy impact on your mental health, and I think it's important to be ready for that. And that kind of brings me on to what I think is a really important point. When you do get diagnosed with something like this, take the time to absorb it, but I think acceptance has to be a goal. That you need to get to a point where you're accepting it. This is reality. And you got to live with it. So what are you going to do now, right? That's the question. And if you can't accept it, you could spend the rest of your life asking why me, and that's kind of a pointless question. There is no why; it just is. So you can just try and deal with it, and that's what I've been trying to do. And I think Stoic philosophy has been very helpful. It's the core idea being you really can't control anything except your thoughts and your reaction to all of the uncontrollable external events. So that helped trying to cultivate that mindset. And then of course I started to research, a lot more about the disease to um try and understand, and to be honest, kind of gain control, even though it's not a good idea, you can't control it, but um just better understand the impact that I could have and what was triggering the flare-ups, and um what could I do? How can I react to this? So yeah, the impact and the emotional toll can be pretty heavy, and it's you can't help but think about things like, I don't have kids, but if I had a kid, would I be able to play with them? Would I be able to run around in the field and kick a ball around? And you've got all that sort of stuff. So I mean, I've worked pretty hard to stay mobile, and this is why, and I'll talk about it later. For me, strength is so important, building strength and building mobility. I go to the gym, I lift a lot, and I'm very disciplined about it. And for me, it's not about big muscles or a six pack or anything like that. It's about being strong and being mobile and being in control of my body as best as I can be. But the reality is like I can't really just live without thinking. I think that's the main impact that this had on my life, is that it's just there. I got to deal with it. I got to think about it. So finally, we are on to treatment. How do you not only live but thrive in spite of psoriatic arthritis and the chronic pain that comes along with it? Well, unsurprisingly, treatment focuses mostly on managing pain, reducing inflammation, and preventing damage to your joints. Some treatment options include medication, physical therapy, and lifestyle changes. From a medication perspective, most commonly you'll see people talk about anti-inflammatory drugs such as ibuprofen that can be bought over the counter, or maybe DMARDs. Both of these target and reduce inflammation in the body. However, prolonged use of them can be problematic. More recently, advances in medical technology have seen biologic drugs take over. And these drugs can have life-changing impact in terms of managing both psoriatic arthritis, rheumatoid arthritis, and other conditions. However, I'm not going to talk about these drugs because I'm not a doctor. This is a conversation you need to have with your doctor and maybe your rheumatologist. What I would like to talk about are some of the lifestyle interventions and changes that you can make to help manage this condition, and some of the things that I do on a day-to-day basis to help me live with the condition. So, treatment. When I got my diagnosis, the first thing the rheumatologist did was schedule an appointment with a nurse to take some blood to test me for latent TB. That was so that I could go on this drug called Humira. Now, ultimately, I decided not to go on the drug, and this isn't me advocating for or against drugs. I think there are people that are in a much worse situation than I am in terms of how they feel the symptoms and the impact it's having on their life and their ability to exist and move around in the world. So I decided not to take the drug. I think there's many reasons. I'll probably go into it in more detail in the future. But the main thing is I don't want this hard dependency on a drug company where, I'm injecting myself with this biologic drug, a drug that has some pretty serious side effects, potentially. They do tell you that it's very unlikely and whatever, but you're playing with your immune system and you're lowering the effectiveness of your immune system. So I decided not to take the drug, and I decided to see how can I best manage this. And over the years, I've kind of settled on 6 things that have really helped me. And those 6 things are walk, eat, sleep, move, lift, and breathe. That's it. 6 things. It all sounds pretty simple, but the challenge is in the discipline and the consistency and in how you incorporate these things in your life. So to go into a little bit more detail, the first one is walk. I mean, that's what this whole channel is about. It's called Walk with Kev. I've got an Instagram page where I post pictures every day of me going out for my daily walk. Every morning I get up, first thing I do is get up, go walk, because it loosens me up, helps me feel better. If I'm feeling stiff, that stiffness will usually be gone by the end of the walk. That's not always the case, but there have been days where my hip or my lower back in particular has been really bad in terms of, like, I've been having a flare up or whatever. And when I'm out walking on those days, I have to make a conscious effort to, like, squeeze my core tight to try and support my lower back, or tense my glute muscles to provide that extra bit of support. And on those days, I really appreciate the ability to walk. So, it's something I want to do as much of as I can, because I really appreciate it. And I think, walking has a whole host of benefits, and you can find a lot of studies. There is the science, but to be honest, I don't care about the science. Go out, do it, go walk every day, just 10-20 minutes a day. Feel the benefits. They are there. You will feel better if you do it. And yeah, I mean, I will probably do a more detailed video on walking in the future, but I really think walking is medicine, and it is probably one of the more important things. I've got a theory that I'll go into in the future where, we evolved as animals and we evolved to need certain things, like we need sunlight. We get vitamin D in our body from sunlight, which is a critical thing that we need. We need water, we need food, obviously. And I actually think walking is another thing that we need. It's just that you stop drinking or if you stop eating, you feel the effect of it pretty quickly. But with walking, I think you can not do it for a long time before you feel the real negative effects. But I really think our body has evolved to need walking because it does so much good for your internals, that it is essentially part of our adaptation to our environment is walking through it. But I'll go into more details on that in the future. The second point, eat. Diet's critical with this. It's interesting. I've done a couple of elimination diets over the years, and actually I just did one for the last couple of weeks. Basically, I've eaten nothing but eggs, fish, sweet potato, nuts, broccoli, apples. That's it. and my symptoms more or less disappear. Then Easter came, and I think it was the Friday before Easter. There was this big dirty Easter egg in the house, and man, I ate a stupid amount of chocolate. And for the week up to that, on the elimination diet, I was feeling great. My symptoms were gone. I was sitting down and standing up and not being stiff, and that's normally if I sit down on the couch, I'll be stiff getting up. But now I wasn't. I was getting up and I was feeling okay. And then I ate that stupid amount of chocolate. And the next morning, I could barely move. My spine had just seized up. It was like it had been wrapped in barbed wire or something like that. And that was just one half an hour binge on chocolate. And literally every joint that I feel pain in was on fire that day. And maybe that's only true for me, but in a lot of the kind of websites and medical sources, they say diet's important, um, but it's not necessarily proven to have a positive impact on this. And that just blows my mind. If I was more conspiratorially minded, I might think or suggest that maybe big pharma and the food industry are in bed together to um, try and stop people using diet as an intervention for these sorts of conditions. It definitely has an impact on me. Sugar, processed oils, and refined carbs, they seem to be the real triggers. So I've been on this elimination diet. I'm trying to work stuff back in because it's disgusting. Like eating nothing but sweet potato and broccoli and eggs for pretty much every meal with nuts and apples as snacks. Like it's grim, but I feel a lot better. I was also fasting. Fasting makes a big difference. If I don't eat for like 16 or 18 hours, again, I feel a lot better and my symptoms stiff kind of disappears. So there's definitely something going on with food. If I eat loads of food to the point where I'm bloated, um, I'll definitely feel some pain and stiffness. If I ever get like constipated, or if, how do I say this tastefully? If my output is not as solid in consistency as you'd like, um, that usually coincides with pain, right? If I'm having any sort of digestive issues, will there'll usually be some sort of flare up or pain there as well. But diet, digestion, definitely plays a big part. So walking, staying on top of diet, huge. They are the two biggest things. The next thing I'll talk about is lifting. So lifting weights. Now you can lift weights, you can do calisthenics, whatever it is, but it's putting your muscle under strain, building strength, building some muscle mass. I always feel better after workout, after lifting weights, even if my hip is sore, right, and my lower back is sore, and I go to the gym and do some heavy squats. I kind of just work through the pain in a safe way. I will feel a lot better. It's almost guaranteed. I will just feel a lot better. So lifting for me is hugely important. There's a whole host of benefits that we'll probably go into more detail in future videos. But I found lifting weights to be critical. And also, I mean, having that extra muscle mass to support your joints that are having problems is really really helpful. So that's why lifting is on the list. I'll talk about move next. So I put in move, and by move I mean mobility and flexibility. So this is, for example, flexibility, your ability to touch your toes. And mobility and flexibility are different things. And the way I would describe this is, imagine you're standing in your kitchen beside your kitchen table and you put your foot up on the table, right? Now, if you are standing there with your foot on the table, your leg is straight, and you take the table away, can you keep your leg there, right? Or what about if your friend comes in and lifts your leg and puts a book under it, and they keep lifting your leg and putting a new book underneath it until you can't lift your leg anymore? That's your flexibility. That's how high you can get your leg. But if you take the book and the table away, it's all going to come crashing down. That's your mobility. It's, can you hold your leg up in that position? This is true of all your joints. It's about how far can you push a joint into a particular range of motion, and can you control it there? So flexibility and mobility are both important. If you just stretch all the time, you'll gain flexibility, but you won't necessarily have control over the muscles. And that's important, because if you don't have control, you might be stretching into these positions, but without the control, you're more likely to injure yourself. So flexibility, mobility, move, yoga, Pilates cover this. I go to specific mobility classes. Thankfully, I have a gym near me where I can do that with a great coach. So that's on the list as something that's very important. And I'm actually very mobile and flexible, in spite of disease. If you saw me doing some of my stretching workouts, which I'll do videos on all this stuff and maybe share some routines, you probably wouldn't think that I have arthritis, especially not in my spine. So let's move. Next, I will cover breathe. So breath work has been huge for me as well. So stress, it's kind of annoying because stress and anxiety can trigger the inflammation and make your symptoms worse, and then having bad symptoms can make you anxious and stressed. So it's kind of this reinforcing feedback loop of shit. So breathing, there's two reasons I breathe. One is to relax, right? So you can breathe like a simple exercise you can do is breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds, hold it for 4 seconds, right? And just repeat that for a few minutes. You'll find you get more relaxed, especially if you're breathing through your nose, which is a good skill to practice. And that will help calm you and relax you. I also do cold showers. I stand under freezing cold water and I breathe to try and promote that calmness and reduce my um, levels of stress and anxiety, even in that kind of very stressful situation of being bombarded with ice cold water. So it's breathing for relaxation, but it's also breathing for power. And this is something I learned through weightlifting, where if you, and you can try this now, if you breathe into your belly, right, and like a deep, and you can squeeze all of the muscles in your belly, kind of around your core, and it's called bracing, right? So you've got air in your belly and the bottom of your lungs, and you're squeezing all the muscles in. So you create this really tight airbag there. And what that does is create support for your lower back. So what I'll often do is I'm sitting on a chair, and if I'm feeling a bit stiff, I might go brace it and stand up. And as I stand up, that brace is easing the pressure on my lower back. And it just helps, right? You can use that to create power and mobility and flexibility. You can use your breath to help you in all these things. So breathing is a very, very important thing on the list. Then there's sleep. I mean, sleep. The World Health Organization, I think it was, has classified night work as a probable carcinogen because sleep is so important, and not following a kind of a standard circadian rhythm that our bodies evolved around is that detrimental to your health that they consider it carcinogenic. So sleep is really important. I try to practice good sleep hygiene because it helps your body recover, your muscles recover. It's good for your brain, and obviously things like stress and anxiety and stuff like that can get worse if you're lacking in sleep. So sleep is a very important one. I try to practice good sleep hygiene. Try to go to bed at the same time every night. Get up at the same time every day. I don't leave my phone in the room with me. I put it in a different room. Try not to look at screens. Ideally, not eat an hour or two before bed. All these things kind of help with sleep. And like I mentioned before, having arthritis can be very disruptive to your sleep because if you're sore and stiff in the night and you roll over, the pain can wake you up, and then you're comfortable. It can be hard to get back asleep. So I think cultivating that sleep routine is really, really important. So I think we've covered them all, right? Walk, diet, we've got lift, move, breathe, sleep. I'm going to do a lot more content on all of these things, but they are my kind of main lifestyle intervention. Now, when you're looking online about arthritis and what you should do, one of the first things you'll see is about losing weight, and that is true. Being overweight is detrimental for your health in general, but especially with this condition because it's pro-inflammatory. Like I said, the foods you're eating can have a big impact, but I'm less concerned about losing weight as a focus. If you focus on the 6 things, weight won't be a problem. Not after a while, because you're going to be eating well, you're going to be moving more, you're going to be building muscle, you're going to be sleeping right. So the weight won't be a concern. That will be a side effect. But if you are carrying a lot of weight, it is going to be putting more stress on your joints. It is going to be problematic when it comes to managing this disease. Thank you for watching the video. If this was helpful, please consider liking and subscribing and sharing with someone else if you know that they're struggling with this or a similar condition. It might also be useful to share this video with family or friends so that they can, get a better sense of what you're living with and how they can support you through your journey in living with psoriatic arthritis.